Okay, I'd like to change the direction of the questions just a little bit. I'm going to skip down. These are great questions, great feedback. But we have to think about, why are we doing electronic health records in the first place? Set aside the incentives, set aside the cost. It's all about the patient care and what are we doing to improve care in our healthcare system. So the question I have for the panel, I'll start on the right this time, is what has been the impact to the clinical documentation and your ability to provide better care and information to your patients?
The clinical documentation, if you use the electronic health record the way it's intended, and if you use the templates, we can track numbers on a lot of variety of things. And we specifically in our clinic decided to apply for the patient-centered medical home, so we had to have 3 areas of our focus, and we chose diabetes, of course, which in primary care is rampant, and then also hypertension and hyperlipidemia, which very much flow into that. So we are able to go through actually and look at the numbers. We can look at the numbers as a clinic. We can look at those numbers as a physician. We can even look at, we can even pull out of our EMR. So if somebody has a hemoglobin A1C that's greater than 7, we can even pull those people out, who they are, and the nurse can call those patients and get them back in. So we have a lot of tracking that we can do. The other thing I noticed that one of the reasons I think it takes us longer to see patients is because once you start, you realize that Grandma Moses hasn't had a mammogram for 3 years, and you know, if you talk to her, she wants to have some intervention done if she did find something. So you find these other things in the system that you realize that people are not following through with. Our immunization rates, I think, are better because we're able to see right up front, you know, what they're missing. And we also have some, recently when we upgraded, we were able to put in some clinical care alerts. So if somebody needs to have follow-up on a chest nodule in, say, 3 months, you can put a little alert in there so that any provider that opens that chart, that alert will pop up that it's time for this patient to do this. So if they don't come back, it catches things that you wouldn't catch otherwise.
As of right now, I mean, because my clinic, we're all in various stages of implementing it. We didn't all start at the same time, and that was kind of against what me and my office manager kind of wanted to do. Everyone kind of wanted to take it slow and ease their way into it, and by doing that, we've drugged the process out. To what Paula said, I mean, that's the intent of the EMR right now, and early on, a lot of people aren't going to see that. They're just going to see, well, it's more of a hassle. I don't know how to operate it, so I can't find things properly. But I think that once you get into the system, and on the notes that I have done, I realized that, you know, it almost forces you to do the things you need to do. You know, going through the family history, going through mammograms, and going through pap smears and colonoscopies, and making sure that those people are up to date. You know, even on your normal patient that has a sinus infection, you'll see those things that are missing. So you're catching things that normally, you know, that person who comes in for their sinus infection, they don't come back in for 3 years for their physical. You will catch those things that normally you would not catch. And I will tell you, I can't tell you how many times I look in my paper chart and I go, well, where's this colonoscopy? Well, where's the lab that I ordered yesterday? Or I'm waiting on this, waiting on that. Whereas it's at the click of a button, as opposed to my office manager, or, you know, office staff running down, going and getting it, pulling it off a fax. You know, time-wise, it eventually will help out.
The availability is there with most EMRs, excuse me, mine included, to, as Paula had mentioned, you know, clinical clues, clinical tracking to say, you can set up alerts where if you've got a diabetic who hasn't had an A1C in 3 months, when you open up their chart, it's right there in the alert section to identify they're due for an A1C. Or if there is an abnormal mammogram, you can put a mark on that says, we know this patient's supposed to follow up with the specialist in the next 2 months. If they don't follow up in the next 2 months, I'm automatically alerted with an email essentially that says, okay, we expected this patient to have followed up with the specialist, and we can see we've not gotten this report back yet from the specialist, so we can call the patient and find out where they are in the process. So, you know, these kind of automatic alerts that would have been impossible to keep tracking unless the patient basically came back in, hopefully in time, are easily facilitated. And then to be able to track data as well, our EMRs, we've got interfaces with the two primary labs that we use, which are Quest and LabCorp. And so when I order labs, we send the labs out, the labs run the tests, and the results come right in. They go straight into the patient's chart, and so I can view the lab report just like I would have on paper before. But not only do they go to the patient's chart, it also feeds into a flow sheet so that the last 10 creatinines that I've done on the patient are just right there at the click of a button as well. So I'm not just looking at one, I can look at the last 10 in an instant.
Our EMR does all those same things. So I echo what they're saying about quality. In addition to that, I'll bet you every clinician in here who participates with Blue Cross Blue Shield or United Healthcare every quarter gets some little report about their deficiencies or whatever, and that's all just based on claims data. Well, our EMR, basically we have set it up so that reports can come on every eligible woman who has not had a mammogram. It's reported. I mean, it's available there for you to look at, and if you see people who are due, you can have a medical assistant call them and tell them they're due for a mammogram. And the latest implementation for patient care in ours came with our last update. We now have a patient portal so that the patients can access parts of their record. They can schedule appointments. They can send us emails through the system with questions that we can respond to. And that so far has been slow to take off in my clinic in Wyandotte County, but there are some of our clinicians in other places who just absolutely love that aspect of it.
Obviously, we come from a different perspective since we haven't implemented, but I echo all the sentiments, and it's pretty much the reason why we're not there yet. We have systems in place right now where we've got registries, we've got full-time employees doing tracking data and referrals that they track on a daily basis, and we couldn't find a system that would do everything we wanted it to do. It's there, it's out there, we know it is. We also couldn't find a system that could get us to a clinic that was doing what we wanted to do. So that was a big part of our process. We wanted examples. We wanted to go to a 10-provider clinic that they could show us how, we got to a 1-provider clinic, and it wasn't the same. So I see huge benefits in electronic records. I think if anybody is paying attention, that quality data is gold right now. And we have to be able to provide our own data, otherwise it's all claims, and we know how good those are. The other thing I think an EHR can provide us is significant efficiencies in billing, in prescription writing. You're not having to write it in the chart and then on a piece of paper, and you're not having to recode everything you wrote into the chart. So I think there's huge benefits to them, but it's exactly why I keep saying what I'm saying. You have to put your diligence into the search process. You got to know what you're getting. You can't get it just because you want to get an incentive. You need to know what you currently do, what you're going to do in 2 years, and make sure that system's going to be able to do that. That's where we're at in the process, and we're excited about it. We just want to do it right.
As I said earlier, we're a little bit different because we're a residency program, but we too are in process of setting up a patient-centered medical home, and part of that, of course, is EMR and doing all these things. But on a personal level, having the, I can think back when I've been in practice for over 40 years, and I know that when I had a patient-centered medical home 30 years ago, but it was a 3-man practice, and we were in a small group, and everybody knew everybody about everything, and we knew when things got done. That doesn't happen anymore unless there's some sort of a trigger to make, like he has a system, but the computer with your electronic medical records, it doesn't let you get by. It reminds you. And it kind of drives you crazy, because if you happen to prescribe something that duplicates the same kind of medication, up comes this thing on the front of your screen says, did you notice that you are giving something that's going to compete with this other thing? Well, all of that is better medical care. I don't think there's any doubt that electronic medical records, if used properly, will give better medical care, but it still requires for a physician to have the integrity to handle it properly. And I get concerned about templates, because it's easy to fudge on templates and say you've done things you didn't do, and you don't mean to do that, but if you don't have integrity about it, you can cheat on electronic medical records like you can on paper records or anything else.